I think, first of all, it would begin with the recognition that all housing is in some sense public. I mean, this is factually true in this country to the extent that the government, federal and state governments, in one way or the other, they subsidize all forms of housing, from home ownership to what we generally understand as public housing, through tax credits or direct subsidy. So in that sense, the idea, this is part of the stigma, and we have seen this with healthcare. We've seen it with many of the recent discussions about the role of government. The idea that there is a thing called the public, and the public is not necessarily me, is in a sense the first kind of hurdle. The public is in a sense what's common, but the other aspect of this that we've learned, I think, since these early policies and over these decades through new social movements, through other kinds of political processes in this country, is that the public is multiple. There are many publics. They are not reducible to their sort of self-interest. They're not entirely to be represented as a set of interest groups. But importantly, this whatever one would describe as the public sphere, the space in which, or realm in which the sort of these kind of shared questions are debated, discussed, and formulated, like in which dreams are produced, you could say. Then this set of publics is sort of comparing notes. I mean, it's simply in the process constantly of debating its priorities.
So.